Thank you, everyone, for putting your name and organization that you represent in the chat box. I really appreciate that. I'll provide a couple reminders throughout the meeting.
Okay, I think we'll go ahead and get started. Good morning, everybody. Hope everybody's dry today and a little warm. It's freezing out here in the desert. But we will call this December 15th Continuum of Care meeting to order. At this time, Josh, do you want to do the roll call?
Yes, absolutely. Let me pull up my attendance sheet.
And then while you're doing that, just a reminder, please continue to mute yourself if you're not speaking and use the raised hand function when possible to be recognized.
All right, so we will start at the top. Of course, we go alphabetically. So Access Foundation.
Present.
Thank you, Cordell. Catholic Charities. CityNet.
Here.
Is that Jessica?
Hi, good morning.
Thank you. City of Corona. Karen, I saw you on here.
Good morning, everybody.
City of Eastvale.
Here.
City of Hemet.
Yes, Linda is here.
Thank you, Linda. City of Lake Elsinore. City of Menifee.
Good morning, Edna is here.
Thank you so much, Edna. City of Moreno Valley.
Here.
Thank you. City of Marietta. City of Marietta. City of Paris.
Here, Rebecca Rivera.
Thank you. City of Riverside. City of San Jacinto or Harp Outreach. Coachella Valley Association of Governments or CVAG.
Yes, good morning. Anise Smith here.
Thank you, Anise. Coachella Valley Coalition on Youth Homelessness. Coachella Valley Rescue Mission.
Good morning, everybody. Kimberly McKinney.
Thank you, Kimberly. It's great seeing you yesterday. Thanks for joining today.
No, it was fun. Thank you, guys.
Community Health Association, Inland Valley. In the
Brianna
Southern
here.
region. So, thank you, Brianna.
Josh, I did notice that Nicole from Lake Elsinore joined. So.
Excellent. Thank you so much. And if we do have anybody joining late, just so everyone's aware, or if you're having trouble with the microphone, I will be checking the chat periodically. Please put your name and organization in there, and I will update the attendance as we go through. Department of Public Social Services.
Tamika here for Linda Salas.
Okay, excellent. I did receive an email earlier this week regarding change in membership, so thank you for that. I'm going to make a note here.
This is Sister Casey.
Desert AIDS Project. Monica, I saw you here in the chat.
Present. Good morning.
Thank you. Good morning. Desert Healthcare District.
Here.
Thank you. Faith in Action. Foothill AIDS Project, or FAP. Habitat for Humanity. Inland Empire Health Plan, or IEHP.
Good morning, I'm here.
Thank you, Ben. Jewish Family Services of San Diego.
Good morning, I'm here, this is Becky.
Thanks, Becky. Lake Elsinore Unified School District. Lighthouse Social Service Centers. Sorry about that.
Good morning. No problem. Good morning. It's Karen for Lighthouse. And Josh, just to let you know, I am going to have to step off at 11. I have another meeting.
Thank you so much for that heads up. Appreciate it. Lutheran Social Services. Martha's Village and Kitchen. Mental Health Systems.
Lisa Matthews for Michael Questra.
I'm here, Franco.
Okay, thank you so much.
Thank you.
Mercy House.
I'm here, Dave Jacobs.
Sasha also, Sasha Garrett.
Okay. I believe you guys have sent me a letter. I'm going to follow up with you after this meeting. Dave Jacobs, I know you always represent for them.
Thank you.
Absolutely. I probably say this every meeting too, so my apologies. Molina Healthcare.
Good morning, Jackie Portilla here.
Thank you, Jackie. Operations Safe House.
Good morning, Rainbow Marlar.
Thank you, Rainbow. Path of Life Ministries.
Yes, good morning, Leonard Jarman.
Thank you, Leonard. Department of Animal Services. Looks like we need an update there, Emma, huh? Riverside County Office of Education. Riverside County Hot Team.
Good morning. Both of us are here today.
Excellent. Thank you so much. RUHSBH, Riverside University Health System Behavioral Health.
Good morning, Josh. Marcus Cannon.
Hey, Marcus. Riverside Unified School District. Shelter from the Storm. Angelina had given us heads up that she wouldn't be here today. Step Up on Second.
Here, Greg Coffos.
Thank you, Greg. Transgender Health and Wellness Center. UCR Health. United Way of the Inland Valleys.
Hi, everyone. It's Danielle. I am the representative replacing Ken and Lorraine.
Yes, and I did receive your letter too. My apologies, it's not on this this membership list, but I know we've exchanged a lot of emails within the past few weeks, so I appreciate that. And I'm sorry, I'm just going to put K because like my last name, I know there's a lot of letters there.
That works. Thank you.
Thank you. US Vets. And VA Loma Linda Healthcare. Oh, sorry. Valley Restart Shelter as well.
Yeah, this is Susan. I'm here.
Thanks, Susan.
Hey, Josh, did you get the city of Harupa Valley? Because I see Amy Sells is on, and I know she's attended more than 3 consecutive meetings. I know her city manager did appoint her, so I wanted to make sure if we get the Harupa Valley on there.
Thank you for catching that.
It is a new voting member.
Yes, and you know what? I didn't move them up yet on my master list. I had it highlighted, and so my apologies. And yes, I will put that up there as well.
Thank you. I saw it on the agenda, so I knew you had it.
Just some small housekeeping stuff. My apologies for that. So let me just make sure that we have quorum. And we sure do.
Great. Thank you, Josh.
Absolutely. Thank you, everybody, for your patience and going through attendance, putting your names in the chat box and the organization you represent. Really appreciate it. It's important for housekeeping and establishing voting rights and keeping us up to date here. So again, thank you all.
Okay, Josh, you didn't call me.
I'm sorry, who's this?
Sister Casey, Oasis Community Group.
Let's can you send me an email and let's touch on that offline, and I'll make sure I update all records, okay?
All right, thank you.
Absolutely. And just so everyone
Josh,
is aware too. I'm sorry, Melanie?
real quick, Sister Casey, make sure it's noted in the chat box so that they can capture the attendance, because you'll have to attend 3 consecutive meetings to get your voting rights back.
Mhm. Yeah, thank you, Melanie. As I was going to say.
And to be mindful of time during the meetings, he usually just calls attendance for those voting members to make sure we have a quorum. But if it's noted in the chat box, we will record it toward your attendance.
All right, thank you.
You're welcome.
Thank you, Melanie. I was
Thank
about
you,
to provide that same exact explanation. So now that we're done with roll of voting members, let's move forward if you're ready, Greg.
Yep. All right, so item 1A is our new voting members. So welcome to Foothill AIDS Project, the Inland Empire Health Plan, or IEHP, and the City of Jurupa Valley. So welcome to you all. And again, for those on the call, to note, and Josh just made reference to it, that, and so did Melanie, that you need to attend at least 3 consecutive meetings to become a voting member. And if you desire to be a voting member, just let Josh or the CoC staff know. So, all right, moving on to item number 2, consent items, is the approval of the November 17th, 2021 CoC minutes. Are there any questions or corrections to start? Again, please use the raise hand function. Not seeing any raised hands, so I would entertain a motion to adopt the meeting minutes.
So moved, Cordell Thomas.
Thanks, Cordell. Is there a second?
I'll second Kimberly McKinney.
Thanks, Kimberly. Any further discussion? Not seeing any raised hands, so due to the volume, we'll see, are there any objections? Or any abstentions? If not, the motion passes. Thank you. We'll move on to item number 3, public comments. First of all, Josh, were any public comments submitted to staff?
No, they were not.
Okay, thank you, Joshua. Any public comments from the group? All right, not seeing. We will move on to item number 4, new business. Item A is the Home American Rescue Plan presentation, and I believe we are graced with Juan Garcia's presence today.
Hey, Greg, before we move on, I think David Jacobs has his hand up.
Yep.
I just want to check if it's referring to the public comment.
Yep, I see that. David, go ahead.
Public comments, so are we open to like provide information about things we have going on, or is that going to be a different section?
Usually we do those under announcements.
All right, then I'll wait for the announcements. Thank you.
Sounds good. Thank you. All right, Juan, are you with us?
Yeah, I'm here, Greg. I can start as soon as, okay, there we go. Good morning, everyone. My name is Juan Garcia, and I work for the County of Riverside Department of Housing and Workforce Solutions. Our unit oversees federal and state funding that the county receives direct allocation, specifically for housing programs. I'm excited to announce that the county is receiving a direct allocation of $8.8 million in one-time funding from the HUD. Can you move to the next slide, Josh? These funds are coming directly from the American Rescue Plan Act that HUD received, and every county and city that receives a direct home allocation is receiving an allocation of these funds. One of the requirements of these funds is that we need to put together, the county needs to put together an allocation plan, and part of the allocation plan requires that we consult with interested stakeholders that work and serve the target population that these funds are intended for. Next slide. Can you actually go to slide 3, Josh? I'm sorry. The next slide. So the target population is what you see here. Funds are intended to assist individuals that are homeless, people at risk of being homeless, people fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, and trafficking, and veterans and families of veterans that meet the above criteria. Can you go back to slide 2, Josh? Slide 2. You have to go one back. Okay. Did Josh, are you on the line, Josh? Okay, I can go. Home funds are eligible for 4 different activities. We can use home funds for production and preservation of affordable housing, permanent affordable housing. Funds can be used for tenant-based rental assistance. Normally, it's 12 to 24 months of rental assistance. Funding can be used for homeless prevention, supportive services, and housing counseling. These funds can also be used for purchase and development of non-congregate shelters for families experiencing homelessness. Slide 4, last slide, Josh. We've already consulted with, we had a survey that went out to all the interested stakeholders. We've met with CoC staff, and CoC staff shared a gap analysis that was prepared by LaSar that was dated June 2021. And one of the major barriers that was identified in this analysis was the lack of affordable housing being one of the major barriers for the cause of homelessness, and we agree with that. And I wanted to share currently in the county the production of permanent supportive housing that we're involved with in our department in partnership with behavioral health. Over the last 10 years, we've been able to exponentially increase the production of permanent supportive housing. As you can see on the slide, currently there's 309 units that are either in operation or under construction, 142 units that are going to be under construction within the next 3 months, and 196 units that are in the early planning stages where they're trying to obtain financing. One of the key things is that the state's making a lot of funds available, like No Place Like Home and Home Key, and these funding programs are identified in the gap analysis that LaSar prepared. And we feel that allocating some of these funds specifically for permanent supportive housing to support these projects gives these projects an advantage in competing for some of these competitive funds. There's a wide range of available uses for these funds, and we wanted to get the input from this group that serves this target population on what we should be considering. And once we do have a final plan, we plan on coming back to the continuum of care and sharing that plan and see if we're moving in the right direction. The allocation plan needs to be approved by the County Board of Supervisors and submitted to HUD. We would like to submit it in the early quarter of 2022, and then start working with developers on potentially seeking projects out. So I'm available to answer any questions that the group might have. And any questions that I might not have answers to, we'll be sure to write them down and follow up with the group.
Great, thank you, Juan. Great presentation. Karen.
I want to just a couple of comments. I just wanted to thank you for the great presentation and for the focus on the potential for gap financing. We know that it is extremely fiercely competitive to get funding. We are competing against a lot of other regions that have a lot of additional money. So I think your recommendation to allow these funds to provide gap financing so that we can let the affordable housing developers get higher scores because of local funds is an excellent idea. And we've talked about it over and over in the continuum of care. We have a huge gap for more permanent supportive housing in Riverside County. So I think it's a great recommendation.
Thank you, Karen.
Other questions for Juan? Seeing any other raised hands. One a question for you. So I know like the first round of home key applications are due the end of January. Say there's a project that has, submitted home key for the permanent supportive housing units. Would there be availability within these fundings, say funding capital for, say, supportive services?
We would be able to provide a letter of support, Greg. We wouldn't be able to make a funding commitment, but luckily the application doesn't require a funding commitment that's approved by the board. So we would be able to at least provide a letter of support. And so that's something that we're looking at for a home key and No Place Like Home as well, projects that are seeking those funds.
Okay, I guess then my question though too would be, say, even with the home key application submitted, would there be the possibility of some of this funding going for, capital for other things that wouldn't be covered by a home key, such as like supportive services, say a medical clinic, behavioral health offices, workforce development?
Yeah, so one of the eligible uses is in fact is funding to provide operation costs for those type of projects. Yes.
Okay, perfect. Thank you, Juan. I think you know where I'm going here. So, I don't want to butcher the name, but Ayeko. Go ahead, Ayeko.
I think she's muted.
I think.
I don't show her muted, or he, I'm sorry. We're not hearing you, Ayeko, so feel free to chime in or type your question or comment in the chat box. All right, any other questions? All right, thanks again, Juan, for the presentation. Appreciate it so much. All right, moving on to item number 4B is the Continuum of Care membership survey feedback.
I'm sorry, can you hear me now?
Yeah, we sure can. Go ahead.
Sorry, I had to switch mics. Apologies for that. So one, through this home ARP funds, is the county offering the matching funds to go with Project Home Key? Is that what you're doing here? Or no matching funds for Project Home Key from the county?
Timing wise, Yaku, these funds we're not eligible to make any commitments because the allocation plan hasn't been submitted to HUD.
Okay.
But we can provide letters of support for projects that are seeking home key funds timing wise.
Understood. Thank you.
Great question, Ayeko. Thank you. So, any other comments or questions for Juan? All right, not seeing any, then we will move on. Karen, go ahead with the survey feedback.
Thank you, Mr. Chair. Good morning, everybody. I just wanted to let you know that I'm excited to present the results of the survey. You may know, just because Greg and I have talked about it since we both had the privilege of taking seat as chair and vice chair, that we wanted to do everything possible to work with the amazing county staff to make sure that these meetings support you and benefit you, and that we all work together to strengthen our system. So we developed a survey that was sent out to you, and I want to thank everybody that participated in the survey, because as the slide says, your opinion matters. So what I'd like to do is go to the first slide, Josh. So there were a series of questions that were asked, and it's basically, for those of you that participated, you will recall that there was a satisfaction rating range of 1 to 5, with 1 being the lowest and 5 being the highest. Josh and I worked together on this, and he did some Excel calculations. So we could either show the raw numbers in 2-digit form or round it up. So actually, every question in terms of satisfaction all came in at a 4. But I showed the 2 digits, so you'll be able to see, you know, like this particular one is 4.2, so it's a 4 rating. So what was the satisfaction with the frequency of the meetings? For all of those that participated, the rating is that it's 4.2 or 4. And you may recall that we discussed as a continuum of care that because of our goal to address unmet needs and improve the system of services, we felt we needed to meet every month. And so we've been doing that. And so we thank you for the feedback on that. So let's go to the next slide. We also wanted to get your feedback on relevant content in the meetings. And again, with a rating between 1 and 5, the overall average rating was 4.2 or 4. So we're very happy to hear that you feel that the information that is being presented is relative and helpful to what you're doing and providing so many important critical services in the continuum of care. Let's go to the next slide. Wanted your feedback about productive meetings, and this was especially important for Greg and I as we set out to work with you and the staff to move the needle forward to make sure that we were not just sharing information, but really doing what we could to be more strategic in how we manage the meetings and accomplished objectives. So between 1 and 5, the overall average rating is 3.9 or actually 4, but it was 3.9 with the 2-digit format. So let's move on to the next slide. We asked you about the effectiveness of the existing virtual platform for the meetings, and overall average rating was 4.3. So it seems to be working for everybody, although we have some feedback in a few other slides going forward. So let's go to the next slide. We did ask if there would be value in a hybrid model. I think, you know, with the new world with COVID, we've been in all of these virtual meetings. And I know right now with the recent releases of mandates regarding masks indoors and just trying to keep people safe, I would imagine that we'll continue to have virtual meetings until we are able to get a better handle on this pandemic in the United States and globally. But we did, if at some point we're able to have more meetings in the future, we asked, is there an opportunity to have a hybrid model? Because we wanted to provide flexibility to all of you, knowing that people are so busy and that sometimes it's easier for people to not have to travel, but still be able to participate in the continuum of care meetings. So we talked about an option that would allow for either in-person or virtual. And everybody had good feedback about that. So the overall average rating about that potential option is 3.9 or 4. So let's go to the next slide. We asked if you had any other additional comments. So we've summarized them at a very high level. I'm going to try to move through them quickly. A couple of different people talked about more resources, diverse funding opportunities. Some folks had said even more than just HUD funding opportunities, and more resources about availability of shelter, services, housing. Really, what I gathered from the survey responses is that a lot of our providers are really looking to try to find placements and resources for their clients. There's a lot of people that need shelter and housing placements. And also less repetition on city models that may not help our particular clients. Also more success stories from agencies and clients, hearing directly from the agencies about their success stories, and even individual testimonials from clients themselves. Next slide. Different organizations presenting their services, resources, and models. And a lot of this is handled in the webinars that we have, but from what I can tell from the feedback from the survey respondents was an opportunity to showcase some of those in the actual Continuum of Care meetings. This one, great suggestion, distribution of our Continuum of Care email and phone list to facilitate more community connections and collaboration with each other. I think that's a great suggestion, and we'll definitely follow up with our team to see how we can facilitate that for all of you. Next slide. More training opportunities for capacity building and collaborative service provision. There were a couple of comments about the need to focus on how collaboratives can work together and how collaboratives are functioning and being successful. Also, some of the providers wanted more best practices for addressing COVID and housing first barriers. Next slide. Spotlighting agencies that are collaborating in our CFC. There's another comment where some of the providers want to see where there's multiple agencies working together, public and private, how they're working through those collaborative protocols and helping the same client. There's just a comment, the staff reports are great. Next slide. Dashboard type of real-time data, meaning client referrals, available units and beds. I know that's something that's been talked about for many years, where folks would like to know, is there a way to look inside the system to see if beds are available for their clients? And then ESG grant data, street outreach and rapid rehousing, just more information available about that. And then someone had a concern that there's not enough emphasis on special needs of older adults and the disabled. Very difficult populations to serve, high barriers, and different types of resources to help them be successfully placed in the right type of shelter and housing. Moving on to the next slide. Comment, all information needed is covered and presented. And then the suggestion that meetings should have virtual call-in or in-person options. Sometimes call-in is challenging for some folks. So again, there's that flexibility so that people have the choice to be able to participate in a number of ways. Next slide. Someone made the comment, they love the spotlight on those experiencing homelessness and their experience with services. And this had to do with providers feel that it's valuable to hear from the clients themselves if the actual programs and services are meeting their needs. So I really like that. It's focusing on lived experiences and being able to have clients give feedback about if the programs actually work for them. And more information about the eastern part of Riverside County. So some folks would like to hear more about the Coachella Valley and other parts of the eastern part of Riverside and what they're doing. Next slide. More housing assistance for households with barriers to renting, such as evictions or criminal records. I know we're going to be focusing on some of this in the policy advocacy working groups for high barrier clients. So that's a great suggestion. Updates and success stories from nonprofits so we can determine if the CFC is helping. Again, wanting to give opportunities for agencies to provide updates in the Continuum of Care meetings. Is that my last slide, Josh? Yes, it is. So before we move on to the next agenda item, myself and Greg wanted to thank you all so much for participating. And I wanted to open the floor to see if anybody had any questions or comments to add to this process that we went through. So we can use this information to refine and even improve the meetings going forward as we're going into a whole new year. I can't believe 2022 is almost here. Any comments from anybody? Hearing none, I'll turn the floor back over to you, Mr. Chair.
All right, thank you, Karen. Good recap of that. So echo Karen's remarks. Thank you, everybody who participated. So, all right, moving on to item number 5 is our standing items. Item A is the Board of Governance update. So we are working on the final aspects of the Homeless Action Plan. Excited that this is coming together. We'll have a final planning meeting on the 5th of January with CoC and Board of Governance leadership. And then we will be doing a virtual retreat on January 12th That's for the entire CoC and Board of Governance and others interested. We're really, really pleased about the direction the action plan is taking. And Josh, I believe, will be sending out the save the dates or calendar invites this afternoon on those 2 items. And then secondly, we will have a Board of Governance special meeting on January 5th from 10 to 11. Most of you will get notified of that as well. And these are for the HAP 2 round allocations, specifically for some housing units on that. So any questions on the Board of Governance update? All right, not seeing any. We'll go to item number B, which is the CoC and HMIS lead agency update. Emma, are you kicking this off, I assume?
Oh, yes. Hello, everyone. Good morning. And I wanted just to take a moment to say happy holidays to everyone. And I hope that you all have a Merry Christmas and a Happy New Year, because I don't think we're going to see each other before then. I have just one quick update that I wanted to give personally before I turn it over to some of the members of my team. Yesterday, Carrie and I met with a representative from the state about the California Racial Equity Action Lab, or the REAL initiative. And this initiative is a 3-year statewide initiative for HAP grantees to learn about and receive technical assistance in implementing approaches to eliminating racial disparities in our homeless system. This initiative is really informed by a collective impact model with the racial justice lens to leverage HCFC's investments. And, they really want to have movement towards widespread alignment that leads to changes in the homeless systems and a greater representation for Black, Indigenous, Latin, Native Hawaiian, and Pacific Islanders, specifically with those individuals that have lived experience. So the ask was that as a CoC, we identify a core team of 6 individuals that will comprise the core team to represent our community and participate in the action labs. So there is a very specific ask in terms of the makeup of the participants. They're asking for 2 Black, Indigenous, Latin, Native Hawaiian, Pacific Islanders, individuals with lived experience, 1 CoC lead, 1 data lead, 1 coordinated entry lead, and 1 other non-traditional stakeholder engaged in racial equity and homeless work. And these would exclude providers that provide rapid rehousing, permanent supportive housing, or tenant-based rental assistance programs. So their suggestion was, and I'm looking down because I'm looking at my notes, someone from the Urban League or Hispanic Federation, or any other organization that may be involved in racial equity or homeless work, but not necessarily a direct service provider. So they've asked that we identify this team by January 3rd. So if you are interested, please reach out to me or the CoC. You can email the CoC directly. We will be reaching out to some individuals that, we think are a good fit for some of these other positions. But if you have anyone, specifically someone with lived experience that meets this criteria, or if there is a provider or an organization that does not provide direct services but is involved in the work, to please either refer them to me, or you can send in a nomination and we can reach out to them. So that is pretty much it for me. I will go ahead and turn it back over to Josh so he can move it along to our other announcements.
Thank you so much, Emma. We do also have updates from some of our CoC staff. I know that Jamie, you had informed me at the beginning of this meeting that you had some updates regarding EHV.
Yes, I do. Thank you, Josh. Good morning, everyone. My name is Jamie Gibson. I am a senior program specialist here with the Continuum of Care, and just wanted to give another announcement / update in regards to the emergency housing voucher program, which is a partnership that we have with our local public housing authority. We have an MOU in place in regards to 347 emergency housing vouchers that HUD has allocated, that the Housing Authority is administering. The Continuum of Care is partnering with this effort to utilize our Home Connect system and a good streamlined referral process for these clients. Just to give a little bit of a history with eligible information for these vouchers, these clients will need to meet one of 4 criteria, which would be homeless, at risk of homelessness, domestic violence, those fleeing domestic violence or dating violence, in addition to someone who's recently homeless and for whom providing rental assistance will prevent the family's homelessness or having high risk of housing instability. Those 4 eligible criteria are what will start the process. There is one significant difference in relation to a normal Section 8 voucher intake eligibility that is not considered or waived, which would be our criminal history. So just like the HUD VASH program for our veterans, all criminal activity except for registered sex offenders will be waived for these clients during the intake process. In addition, the documentation for citizenship still stands the same as a normal Section 8 intake person, where they would need to be a U.S. citizen or have eligible immigration status. If they do not as the head of household, as long as someone in the household is a eligible citizen or has that immigration status, they would still qualify. These folks would also be held to the 50% AMI income limits during intake, which is great to capture a lot of our lower income families. And just wanted to throw out that information to you all. I want to include my email in the chat box for anybody who has questions regarding the process, documentation, that sort of thing. We're working closely with the Housing Authority in relation to the Home Connect to make sure our process is as streamlined as possible. In addition to EHV, I also wanted to let you guys know as a group here that we are working with our with Joe Coletti with our Urban Initiatives to bring out what we call a homeless funding resource meeting. What we're going to do in January, which would be specific to January 18th, is provide a meeting to the community regarding all of the upcoming funding opportunities. We did this in the previous division a couple of years ago, I believe 2019. And so we wanted to use this as an opportunity to kick off the year to provide an update for everyone with all of those upcoming funding sources. So please stay tuned for some information on that as well. Thank you, Josh.
Jamie, do you have a time on the 18th for that?
I do. Yes, Greg, it would be 2 o'clock.
Okay, perfect. And then another question on the EHVs. Are we prioritizing seniors on that, if I'm not mistaken, or?
Other than the 4 eligible criteria, there's really not a preference. We do just let them know that they need to register on the Section 8 waiting list, and that's how the Housing Authority is doing their release. So as long as your client meets one of those 4 eligible criteria, they would be eligible to be referred.
Okay, great. Thank you, Jamie. Appreciate it.
Sure.
Any other questions for Jamie right away? Not seeing anything. I think Josh Rosh Hashanah has the update too, correct? So.
That's correct.
Good morning, everyone. My name is Roshana Walker with the Continuum of Care. I am a senior program specialist, and I just wanted to provide an update. On October 29th, the state of California announced $47.5 million for encampment resolution funding, and it was for it is offered for jurisdictions with an identified encampment site. So the CoC will be submitting an application on behalf of the county to support the Second District Collaborative for the Santa Ana River Bottom. So we held a stakeholders meeting on December 1st, just to get the feedback and the input and needs from those stakeholders of the second district river bottom collaborative. So because the stakeholders' input and needs are very important to us, we want to include everyone. We actually put a call out for information regarding your needs and input. There was a deadline by last Friday, but it has been extended to this coming Friday because we want to make sure that we receive and include all of the stakeholders in our application. So the deadline is December 31st. But I do have an internal deadline, and it's just for myself. I want to submit before the holidays, so I want to submit by December 23rd because I want to be able to enjoy the holidays as everyone else. So if you have any questions, please feel free to reach out. I will put my email in the chat, and I also sent a couple of reminder emails out to the collaborative. So I just wanted to provide that update. And then also, I just want to provide a quick update on the HAP2 RFP for the capital funding. We did receive applications from 2 developers, but 5 projects. So just want to let you guys know that we're in the evaluation process, and we will be able to have some recommendations to the BOG early January. And those projects would also support the No Place Like Home and Home Key funding that was mentioned earlier in the presentation. Anyone have any questions?
Any questions for Roshana? Karen? You're muted, Karen.
Sorry, everybody. Just to comment back on the meeting that we're going to have in January to talk about all of the different funding sources. I just wanted to make a suggestion. We're going to have this unique, I'm going to call it a challenge and an opportunity all in one. There's going to be a lot of money coming down the pike. And so everybody is going to start to experience a bandwidth issue. So to the extent that when we have that meeting to talk about all the funding sources, there's a way that we can also help to facilitate some suggestions for collaboration between nonprofits and even cities and nonprofits, because people are going to be juggling a lot of different balls. So, and I know that's a core value in what we're trying to do with the action plan. So if there's an opportunity for us to do that, I think getting those conversations started when we're releasing the list of funding would be helpful.
Sure, Karen. Thank you.
Point. Leslie Evans, I saw that you had raised your hand right after Jamie. I didn't know if you still had a question or comment.
I'm sorry. Yes. I was just going to ask about the email, but she put it in. So thank you.
You're welcome. Thank you. All right. Any other questions? So, all right, Josh, is there any other further updates?
I don't believe there are any other CoC lead updates or HMIS lead updates for today. But I will say this on behalf of HMIS, we do receive monthly impact reports or bi-monthly impact reports from the HMIS team. I include these in the staff reports every time that they come out, which is every other month. And it just gives an overview of how many clients were served, clients housed on exit, veterans served, and really breaks down that data. So I think it's really important to look at this every once in a while and take away some of the impact that we have and keep that in mind. I added December's HMIS impact report to the Google Drive folder for this meeting earlier this morning. So please take a chance to look at that. And if you ever have any questions, reach out to us at coc@rivco.org. And I know that Gordon is always very responsive and really enjoys communicating with our COC membership and community at large. And if any other COC staff member here has any other updates regarding programs that I missed you, I apologize, and feel free to speak up now.
Thanks, Josh. Looks like we're good. Great job, staff, as always. So item number C, the 2022 homeless point in time count. Laura. I think we're going to show a video first that our esteemed vice chair was in, along with the amazing Heidi Marshall, about the point in time count. This was showed at the Board of Supervisors meeting yesterday. It's a great little video. So.
That's great. That's correct. Thank you, Greg. Go ahead.
And we remember that we're more alike than we are different. We have more similar than we have apart. We're all the same blood and bone and sinew. We all breathe the same air. And I think what that compels us to do is to carry on this work that so many of you urgently do. And to go out kind of carrying these names in memoriam, remembering that as long as we have to get together to have memorials like this, that there's still work to be done.
The National Homeless Persons Memorial, celebrated on the longest night of the year, serves as a stark reminder of what is at stake when we are unable to adequately address homelessness. Lives are lost literally on the streets to substance use, chronic illness, violence, injury, and exposure. To truly make a difference, we must be steadfast in our commitment to address and end homelessness in our communities. It is for this reason that the 2022 point-in-time count has been deemed more than a count. The point-in-time count, or what is known as the PIT count, is a required census of homeless individuals within a jurisdiction. For the first time in our history, the count will go beyond the minimum HUD-required process of counting people and will include the direct provision of shelter, services, and transportation. It is our ultimate goal to provide a shelter opportunity and a direct link to a service provider to all unsheltered individuals encountered on the day of the count. We will need more volunteers more than ever before to accomplish this goal.
The count helps ensure communities get the funding needed for long-term solutions to homelessness. It is critical that we conduct an accurate and thorough count to obtain the level of funding appropriate to serve our entire homeless population. This year, more than 700 volunteers are needed for the count, which is scheduled to take place on January 26th. A separate youth count will take place from January 26th through the 28th, with targeted efforts to identify homeless youth who are often undercounted. Volunteers will receive technical training and will be placed in teams led by professional staff who are experienced in conducting homeless counts. Now more than ever, we ask that you join us in increasing our commitment to make sure that there is an open door to shelter and housing for everybody in Riverside County in 2022.
Our last count conducted in 2020 indicated that on a given day in Riverside County, there are 2,884 homeless individuals. 75% of them are unsheltered and living on the streets. The COVID-19 pandemic further exacerbated housing instability and homelessness, mostly due to income loss, illness, and rapidly rising housing costs. These are significant numbers and challenges for us to address. I am, however, encouraged by the recent success of the Project Roomkey program, which provided emergency shelter to over 1,100 individuals in just over 18 months. And we successfully transitioned 574 of these families into permanent housing. We can do bold things, and we can make big goals. We can do more than just a count. If you're interested in joining us in Riverside County's 2022 More Than a Count, please visit our website at morethanacount.org. And thank you.
Thank you. All right, Laura, take it away.
Thank you, Greg. Good morning to everybody. That's a great way to transition to our 2022 Homeless Point in Time Count update. I'm Laura Gonzalez, part of the CoC team, and proud to be assisting with the coordination of the homeless point in time count in 2022. You can move to the next slide. Thank you. And as the video referenced, our theme for the 2022 count is more than a count, really focusing on our opportunity on that day that we encounter so many individuals, and our effort to see what we can do to link them to housing and services. We want to definitely increase community involvement to facilitate an accurate count. Our goal is always to conduct the most accurate count in Riverside County. We do this through our partnership with our community partners, including city leaders and law enforcement and homeless outreach teams. We will be also working to create a plan, our housing and services linkage plan. It's a new plan where we will either immediately link individuals that want to get off the streets that day, or work with our homeless outreach teams for follow-up 2 weeks after the count, up to 2 weeks after the count. And then, of course, we are definitely focusing and having our dedicated youth count, where we are conducting magnet events that we call Come and Be Connected events that hopefully will also link youth experiencing housing instability and homelessness to youth service providers and community resources. So those are kind of our efforts for the More Than a Count initiative for the 2022 homeless count. Next slide, please, Josh. These are some of our important dates to be on the lookout for. The main count, the general count, is scheduled for Wednesday, January 26th. It is a morning count. And the youth count is a 3-day count that will be conducted from 2 p.m. to 8 p.m. for 3 days. As I mentioned, the Come and Be Connected events, which are new to the count. We will also use the service-based count as a backup in case we miss anyone on the general count. Hopefully we can connect with them through service-based providers. And then, of course, we will focus on the unincorporated areas in Riverside County by working with key partners to conduct that count, that we can conduct 7 days post count, up to 7 days post count. Next slide, please. How are we planning our count? As a lot of you may know and have been loyal to our community planning events, we have scheduled beginning in September our planning efforts through community planning meetings where all of our partners get together and discuss all of the important components of the PIC count and make sure that we plan accordingly. And also do so in compliance of HUD requirements. So today we are having our 4th community planning meeting for the count today from 2 to 4 p.m. And if you are interested in helping and assisting and providing input, you are always welcome to attend. Next slide. The reason why I am here today is to present the methodology for the point in time count. HUD requires all of the CoCs, as many of you are already aware. HUD wants all of the cities conducting point in time counts to be consistent in the way that they collect data. So they release methodology guides as well as a collection notice every year. It was already released by HUD in mid-November. And so one of the tasks that we worked on through the community planning meetings was to review that collection notice and make sure that all of the information that must be collected to successfully complete the count is being collected. And so the methodology for the 2022 count in Riverside County is very similar to the one we followed last count, which was in 2020. Once again, we do this because we don't want to have a lot of differences from one year to the other. Having that consistency in the way we count allows us to be able to compare one year to the other and create trends. And so we don't have a lot of changes in our methodology. We did review the survey tool from 2020. Once again, the notice that HUD released guided us in terms of what we should add and any edits that we needed to make to any of the questions. We were able to do that successfully, and I wanted to present that to you to the CoC today as well. And then, you know, we did submit the methodology to all of you. Hopefully you had some time to review, as well as some of the survey questions, but I can very quickly review it just to make sure no one has any questions. So Josh, can you bring up the HUD methodology that we will be following for the 2022 count?
Absolutely.
While he's bringing it up, does anyone have any questions about our planning meetings or about the count in general questions? Like I said, we've been conducting our community planning meetings, and we encourage everyone and welcome everyone to attend, because that's where we really get into the logistics and the details of the count. And so I do see a question. What is the link to sign up to assist with the count? I'm sure one of our CoC team members can throw that link in there while I review this methodology. And so very quickly, the day of the count, we've decided it's going to be Wednesday, January 26th, as per HUD requirements. So we mentioned a couple of sentences there about what the requirements are for HUD. We do conduct a morning count, but always remember that the question, if all of you have completed a survey or surveyed someone for the count, we're always asking them, where did you sleep last night? And so if we're out morning of January 26th, the night of the count is going to be January 25th. Number 3, the week of the count, HUD does allow us to conduct several activities during the count. For example, the service-based count, as well as the unincorporated area count, and a lot of specialty counts. And so we really do start the count on January 26th with the general count, but we do have that pretty much a week to conduct all of the counting in Riverside County. It's a survey-based count. Again, this is the 3rd year that we will be using Survey 123. It's an app that really makes the survey so much easier to complete. If some of you were here 3 years ago conducting homeless point in time counts, you know that we actually were using pen and paper surveys. So you can imagine the logistical nightmare that was, and I'm glad I was involved in the PIC count then. So the survey really does not only increase the accuracy of the count, but it just makes it so much easier to collect the data. Next, let me see, number 5, HUD once again lets us know who should be included as in the unsheltered count. We've reviewed this with our community partners just to make sure that we're including everybody that should be included, but also making sure that we include in the survey those individuals that should not be included in the unsheltered count. So the survey once again really helps us follow those answers, the responses that the person that we're interviewing answers, and then it'll let us know, okay, this person is slept in a house or an apartment last night, so this survey has to end because they're not going to be counted. So the survey is really helpful in that sense. Number 7, Josh. Subpopulations, same thing. We follow HUD guidance about household types and really just make sure that we are following all of the data collection requirements that HUD provides. Next, number 8, please. Okay, sorry, that was my dog. Methodology, once again, we followed all of the requirements that HUD puts forth in their guidance that we are going to be identifying known locations where individuals that are unsheltered are congregating, the time of the count. Continue with C, that we'll use an app to collect the data, that we will use unique identifiers to avoid duplication. Riverside County is an immense county. We want to avoid the possibility of counting someone twice or surveying someone twice. So we do follow that recommendation. And then number 9 is really kind of what we've been doing with the community planning meetings, volunteer recruitment, promotion of the count, a lot of the pre-count important activities that lead us to be able to implement an accurate count. So that's number 9, and then continue. Number 10, once again, day of activities. HUD provides a lot of guidance and checklists for us. So we will have a command center. I think a lot of people are always really interested in a command center on the day of the count. And that's basically with the help of RCIT, we're able to look at the data live as it's being collected. So I guess, yeah, that is very, very exciting. And so as literally as people, our volunteers are submitting those surveys, we are seeing the count live on our dashboards. So we will definitely have a command center. Post-count activities will include making sure that the data is accurate, reviewing the data once it comes in, and then the analyzing piece, a very important piece of the data collection for the unsheltered count. That's BC, and then reporting, of course, meeting all the deadlines for HUD. To submit not only the unsheltered count data that we collect, but also the sheltered count data we collect. So that, in a nutshell, is the methodology that we would like to have the CoC membership approved today. If you will have questions or are interested in helping with the planning of the count, we still have today's meeting and then another meeting in January to wrap it up before we implement the count January 26th. And then I also have very quickly the survey tool. I mentioned we did revise the survey tool from 2020 to 2022. Our goal is not to extend the survey, because the longer it gets, the more risk we have in losing the interest of individuals being surveyed. We are literally waking them up at 5:30, 6:30 in the morning to survey them, so we don't want to take too much of their time. And so we have had a great success in the work groups that we've been meeting with. Providers and partners did share input with us. And so on the left, you'll see the 2020 survey. If there's changes, of course, there's more questions, but these are the questions that actually were edited or revised using the notice from HUD or using feedback from our partners. So, for example, in 2020, our volunteers were given a surveyor ID. This year, we thought make it easier so that we won't have to issue any kind of ID. We will just ask them to put in their name and their phone number. So anyone that is conducting a survey will be asked that information before they begin. The next one, as you can see on the left, HUD asked us to add tent or shed as an option of where did you sleep last night. In terms of couch surfing, our community partners thought that it was a good idea to expand on that question a little bit more. So in previous years, it was just, are you couch surfing? And then they would, say yes or no. This year, we want to expand a little bit more in consideration of the youth population. And then also HUD asked us to add tiny homes as an option of where you slept last night. So we added that. Same for some of those questions where if we ask someone, where did you sleep last night? And they say, I slept in a house or an apartment. then that survey would stop. But we did also add some clarifying information to that. Next, ethnicity. HUD's requirement was to expand a little bit on the Latinx or Latin. Before it was, are you Hispanic or Latino? And now they want us to expand a little bit on that. Same with race. These are all HUD requirements, added a little bit more clarification in terms of race. Same with gender. Our work group was looking at gender to begin with, but HUD added gender as an edit in the notice. Birthplace, one of our partners suggested to be a little bit more clear regarding how to enter if someone was born outside of the United States, because the previous survey only asked if they were, what city they were born in and what state. Next, let's see. Why are you homeless? We did add family disruption as well as substance abuse as other response options. For incarceration, we had a lot of discussion in our community planning meetings about actually adding this extension to this question. And I think that it's definitely something that a question that will really give our partners working with those that have been incarcerated with more data. And so we're happy to be able to extend a little bit on that question and obtain a little bit more data from those that are answering that they have been incarcerated previously. In the observational survey, HUD made a requirement to extend a little bit more of the question. And so we did that as well. And then let's see, 2 more for why they're using the observational survey as well. HUD asked us to extend that question a little bit more. And then the youth survey, we added trade and school as a response option. And I think that was all. Yes, that was all. And I think I saw a question or a comment. Does anyone have any questions or comments on okay, let's see. Susan, I'm repeating for the committee reports, so the meeting has not occurred, please.
Hey, Laura, that refers to a different agenda item.
For the agenda, I think.
Sorry. Okay, so that is my update regarding the pit count. I couldn't I couldn't do what my coordination task without all of the great help that we get from our community partners that are attending these meetings with us. And so we really appreciate everybody's support of the point in time count in many different ways. And so I had a couple of, I think 2 more slides related to the pit count, Josh, if you don't mind. This is a couple of timelines and important dates that we have for the point in time count. Volunteer registration has opened, as you heard in that great video that you saw. Our goal is to recruit 700 volunteers within the next month. I believe that we have almost 100 volunteers. I think it was about 85 the last time I checked, but I think that was a couple of days ago. So I'm certain that we are getting a lot of support from our partners in disseminating our recruitment flyers. And so I'm certain that those numbers are going to be going up quickly. And so volunteer registration has opened. Today we do have a planning meeting, and then we will have another planning meeting mid-January. We respectfully submit our methodology for approval for the Continuum of Care. Our survey tool, based on any feedback we get today at today's meeting, as well as our community planning meeting, will be finalized hopefully early next week. We are working on securing incentives, purchasing them, collecting them, because we are getting a lot of great donations from our partners. It's overwhelming how generous our community partners are. So we're very glad that that's happening. We will have a volunteer training coming up on January 5th, We don't want to offer the trainings too early on because we want the training to be fresh in all of our volunteers' minds when we are ready to go for the count. And so we will be focusing on volunteer training early January. And then volunteer recruitment does close on January 18th. So that's an important date. And then we will be ready to go and move forward with conducting the 2022 homeless point in time count the week of January 26th, beginning on January 26th. Next. And so, yes, as Emma mentioned in this chat, we need more volunteers. How can you all help us? Publicity and awareness campaign. You all should have the general count flyer as well as a youth count flyer. We have also been able to create a press kit where you can use some of the items in that press kit to post on your social media. Please help us promote and disseminate the flyers to your community partners. And thinking outside of the box is important because we tend to usually go to the same partners, but this is a countywide effort and we need countywide support. And so, you know, libraries and churches and all of those partners that we usually work with are great. But, you know, doing posts on your social media to just let people know that we need help for the day of the count and make sure that we have that support that we need to be able to do all of what our goals are for the more than a count in Riverside County. So if you don't have the flyers, let us know. We have them all PDF versions, and then the press kit has the surveys shrunk or saved so that they're easy to post on Twitter and Instagram and all the other social media that I'm not familiar with. So I'm glad that we have staff on our team that are able to post consistently. So please check us out. And then I don't know if I have another slide, Josh. Did I have another slide? Thank you for helping us plan more than a count. Any questions? Oh, the link. Thank you, Nicole. We are getting some feedback that link for more than a count is causing a little bit of chaos in our partners. The feedback that we're gotten from RCIT is that it's better to open it in Chrome or Firefox, I believe. But please reach out to us. We'll resend the link as many times as we need to for you to be able to access that link. And we do apologize for that. Yes.
I troubleshooted the link as well. You can't include the www. You have to omit it. So just type in morethanacount.org. Don't put www in front of it. If you put the www, you won't get an error. But if you omit it, it'll go straight to the link. So the actual link is not more than a count. We actually, that's sort of on top of the regular, you know, numerical link, but we wanted to have a link that was very distinctive and easy for folks to remember. But if you do put the www, it will give you an error message.
Yes, and we apologize for that, and we appreciate your insistence in making sure that you are able to link onto that. And in the chat, one of our team members added some links. Hopefully those will work. And I will follow up with Lake Elsinore and Nicole Daly to make sure that you have access to that link. So we're very sorry about that.
Can I jump? I'm sorry. Just to be so it does not work with WW, and we tried Firefox and Chrome, and all the promotional materials say morethanacount.org. So it's just we're uncomfortable posting that if it's not going to work.
Yes, we'll follow up with you, Nicole, to make sure that those once again, we did already alert our RCI our IT department, and so if they're able to provide us with some guidance on that, just to make sure that those links work when someone is trying to access them, we'll make sure that we work on that. And we appreciate your insistence on trying to make sure that those are, or ensuring that those are going to work when you post them. So that website is a new component of the PIC count. We've never had a website before, and so we've been developing it within the last 2 weeks. So we're very proud of all the information that's on there, and we hope that it is useful to those that are wanting to learn more about the point in time count. But we definitely want the links to work, so we'll definitely work on that.
Questions for Laura? Right, great presentation, Laura. And I believe, correct me if I'm wrong, Laura, but all 28 cities have a lead assigned, correct, in the county?
We have one that we're still pending, but 27 are 100% confirmed. So
That's amazing.
So that definitely makes a difference. It's a county-wide count, and so having the support and participation of city leaders that know their communities and know where to look and are familiar with where to find unsheltered families and individuals really does make a difference.
Great, perfect. All righty, thanks again for doing amazing work. So item number D under 5 is a CES lead update. Is Myrell on?
Greg, did we have to take action? I'm sorry, did we have to take action on approving the methodology? No?
Sorry. Yes. So I'd entertain a motion to approve the 2022 unsheltered point in time count methodology guide.
So moved, Hammett.
Thank you, Linda. Is there a second?
Second. Karen Roper.
Thank you. All right, any further discussion?
Hi, I'm
Okay,
sorry. Who was the first person that moved the motion?
Was Linda Krupa from Hammett.
Oh, great. Thank you.
All right. Is there any opposition? Please raise your hand. All right. Are there any abstentions? All right. That motion passes unanimously. Thanks for catching that, Karen. Appreciate it. All right. Myrell for the CES lead update.
Good morning, Greg. It's Marcus.
Didn't sound like Myrell, so.
Yeah, sorry. Myrell and quite a few other staff from our agency and other agencies are out doing a large outreach event this morning, so you're stuck with me. Josh, I think you have a slide for us, perhaps, or maybe it's just in the staff report. If it's in the staff report, I can speak to it verbally.
I typically include a slide. We received some updates very recently, so I included these updates in the Google Drive folder, and I do have them up here just to browse quickly. Unfortunately, not a slide, but a PDF document. But it is in the Google Drive folder for this meeting.
Okay. So on this one, I would just highlight that we're continuing to try to make it clearer to read. Our goal here is just to provide a snapshot of the state of the by name list. Who's on it, how many calls we receive, what type of BI SPDATs we're receiving, the breakdown of scores so that we see really what type of acuity we have, the breakdown of number of referrals that are outstanding. Certainly the biggest issue that we continue to face is the challenge in locating housing. With the influx of ESG, there's been many more vouchers available. And so there are a lot of referrals where people are out searching for units, but that amount of time to locate units continues to stay long. At the very top of this sheet, we do include our call numbers. Calls stay relatively high, typically around 1,000 or more a month. And so it's definitely been busy. This sheet again is in the staff report, and so we always want you to have it for your reference, and we welcome any questions that you have about it. You can send them to homeconnect@ruhealth.org or to Myrell herself or to me as you see appropriate. So that's my brief update on that. But then Josh, if I can share my screen, I've got a couple slides as well, if that's all right. All right.
Absolutely.
See you nodding, I'll take that as a yes. So I just wanted to share a couple other updates and announcements. and get feedback on a couple things from folks. A minor announcement, we have been working hard to try to update all of our forms and make them more user-friendly. These include the VI SPDATs, the assessments that we use. There's versions for individuals and adults and families and transitional aged youth. It also includes the other forms that are needed for different specialty program referrals, verifying homelessness, verifying disability. We're making more and more of those forms fillable and also making changes based on the feedback that we get from you all. So we're going to have a training next week at our standing bi-monthly CES partnership meeting. That's 12/21 at 9 a.m. I think most of you get those invitations, but if anybody needs it, please send an email to homeconnect@ruhealth and ask for an invitation. We can get you added. We'll continue to do this periodically. Normally, we try to have guest speakers at these bi-monthly meetings to provide an in-service or a training about some new resource or new program. And we're really grateful. We've had guest speakers from a number of your different agencies. Recently, I know we had workforce development, several others, and those are always, I think we had DPSS through the, I'm blanking on the name right now, Luis from DPSS with disability, HDAP. So we're always grateful to your agencies for doing those guest speaking events. We feel like people really learn a lot from them, but this upcoming time, we're going to work on updated forms. One thing that I wanted to make as a reminder, in Clarity, which is our HMIS system, agency administrators can pull reports that I cropped this on purpose so we don't have the staff's name on here, although this staff seems to be doing a good job. You can pull reports to see when did your staff member last log in, how long did they use it, which can be really revealing. And I can tell you, I've got the whole report of, the whole county, and some people are really on it and using the system a lot. And there's other people who have licenses who it's been a long time since the last login. So I would encourage those of you agency administrators to use this report to really figure out, staff usage patterns and to make improvements and fine tune from there. But wanted to highlight that that's available. And I should say, I know sometimes I talk too fast, so please interrupt me or put up your hands if you have questions or put things in the chat. We've been doing Clarity Basics training, just kind of Clarity 101 on a semi-regular basis. And we will be announcing new dates next week for upcoming trainings. Just to, again, we know your agencies constantly have new staff coming, new programs, and so we want to help get people oriented and conversant with Clarity. As I mentioned, ESG has been a big bulk of our work these last couple months. There's been a huge uptick in volume there, which is great. Jamie made an announcement about EHV, and we're supporting with that. We definitely need more referrals for EHV. So I just wanted to second what she already shared. Those criteria are broadening of who's eligible for an EHV voucher. I know the Continuum of Care team on behalf of Lindsay Sisti sent out an updated informational package last week with all the EHV forms, links, what it is, how to access it. So if you missed that, please look for that in your inbox. EHV is a form of a Section 8 voucher, and it really is, I think, more flexible than ever. Initially, the thought within the Continuum had been to use it to serve those who needed to transition out of PSH that were ready for more independence or to transition off of rapid rehousing. But the team administering the grant been able to expand that to serve those who are currently homeless. And so it really is, in my mind, low-hanging fruit, but the take-up has been slow. And I think that some of that may be related to a comment Karen Roper made earlier about just bandwidth. I think we're all feeling that between COVID and the hiring situation being what it is, the holidays, and the increase of state funds and programs, I hear that a lot from a lot of agencies, that people are feeling like they're kind of hanging on just to keep the seams from coming apart. And so taking on new things is very challenging. And I acknowledge that and empathize, because we feel the same way. I have quite a few vacancies on my team. Hiring is not easy right now. But this really is low-hanging fruit to get vouchers for clients. So if you don't know what EHB is, or you know what it is, but you're not sure if your staff and your case managers know, please really look into that and reach out to us if you have questions. We continue as a coordinated entry system to try to support outreach events and community events and groups. So Morel, again, is your usual face doing these presentations. She's been supporting Yak and Yab and trying to get more data and more accessible data to the Yak and Yab. I included just a screenshot here of a dashboard that she's been providing the Yak and Yab members. As Laura mentioned, we'll certainly be supporting point and time count, providing Home Connect staff, both as counters out in the field as well as behind the scenes support staff to help coordinate those needed services that we're trying to provide on the day of the count. And then we do continue to send out staff for encampment and other outreach type events. Like I mentioned, today is City of Riverside. They're hosting a saturation day, a large scale outreach event. I think they probably have upwards of 60 or 70 volunteers out in the street today. I know we had 4 or 5 staff who started at 5 a.m. It was a cold morning, and my phone hasn't stopped ringing since 5 a.m. But the good news is, as you may have heard me mention previously, RUHS has recently opened a sobering center and a new adult residential substance use treatment facility. And the sobering center has been open for a month. The residential treatment facility just opened this week. We got our license from the state. And I can tell you, since 5 a.m. this morning, it's been filling up. We've been getting people off the streets and solving problems. And so it's exciting to see that outreach event working and to see people wanting to use the resources. So I just wanted to share that update. This is one that I really would beg for some feedback if people are willing to give it in the moment, but I know sometimes a big meeting like this, it can be a little daunting, or you want to think about it for a moment. As part of many either grants or resource opportunities, there's a statutory requirement to verify that the person is homeless. Typically, right, that's an eligibility criteria. If the household isn't homeless, they can't be served. So, and I know this is remedial for a lot of you, so forgive me for walking through it basically, but I would just want to lay the groundwork and make sure we're all on the same page, because I know we have so many different disciplines on the line. Typically, what would happen is that a shelter worker, a street outreach worker, a field worker would complete this type of letter on behalf of their client to certify the client is homeless. I've observed this person living in a place not meant for habitation. It's this location for this duration. Here's my contact information. Here's my phone number. Here's the agency for which I work. And they would send that to us, to Home Connect. And we keep that so that when we're able to refer this individual for a housing voucher or a resource, we send that to the agency that's ultimately going to serve the client. And the agency uses that letter for their files, so that if they're ever monitored by their funder, whoever that is, they have some documentation to say, yes, this was an eligible client. This is a process that's been in place a long time. Many years ago, close to 10 years ago, it was more common that the agency that ultimately served the client would do it themselves. They would get the client and then they would make the verification. However, the feedback at that time was that that was a slowdown. And so agencies that had grants, that had opportunities, wanted clients to come with documents in hand so that they could, establish eligibility right there on the spot. This process still, I would say, generally works. And we get a lot of these letters from a lot of your agencies and lots of other agencies. We also, though, get I would say it's a minority, but it's enough of a minority that I wanted to address it here. A number of times where we notify the agency, who's the outreach agency, the field-based agency, can you send us a verification of homelessness for your client? And they say, oh yeah, we will. but we don't receive it. And that could be for any number of reasons. They forgot, they got busy. You know, this isn't about blaming those who are doing or not doing the letter. But then they call back and say, hey, did you get my letter? We say, no, we didn't get the letter. We send the form back. They fill it out. They send it back. Maybe it's not filled out right. We send it back again. There's a lot of back and forth here. And it's, you know, just not a valuable use of time for the folks at that agency. And for our staff, we don't want to be an impediment to anything. So, sort of the two questions that I wanted to ask. Each of us have different funders, but certainly the CoC team, as our collaborative applicant, funds quite a few activities for quite a few people on the line. So the question that I would want to ask for the CoC team is, could we do this? And then if we could, would other agencies want to? And my suggestion would be to modify this form so that if I'm Home Connect staff and someone calls me from a shelter, calls me from a street-based outreach and says, hi, Home Connect, you know, my name's Marcus, I'm a street outreach worker. I'm here with this client. I'm calling in and I'm wanting to do a homeless verification. Could we record it over the phone, who the staff member is, where is the homeless individual, what's their name, what's their, you know, pertinent information, where are they staying, for what period of time can that staff member verify the homelessness, and then that staff member's contact information, and then save it. And the idea would be that that would serve as the homeless attestation. Just as with COVID, lots of us who, you know, used to have a wet signature on things, our various regulatory agencies started accepting verbal permissions for consent, verbal permissions for authorization to treat, verbal permissions for release of information. In my mind, this would be a bit like this. I saw Susan put a comment in the chat saying, would HUD accept it? I don't know. That's why I'm bringing it up. But I wanted to at least raise this idea as a way that potentially we could save time, if it's allowable, from the regulatory standpoint. And then number two, from the agency standpoint, agency administrators would need to be comfortable with this, that their staff is going to call us and we're going to record a verbal verification of homelessness. If we can get through those two hurdles, I think we can really save some time here. So I want to pause and take any feedback, and I see Jamie Gibson has her hand up.
Hey, Marcus.
Good morning.
Yes, I did see Susan's comment, and thank you, Susan, for thinking about HUD. I will definitely say to the group that I will inquire so that we have an official response in regards to that to ensure that we are compliant. But I very much would agree and would like to see this more of a, you know, it's more of a streamlined process. And I think we're moving more towards an electronic base. So some of our funding is a little bit more loosely written as far as regulation goes. So there may be more of a wiggle room with some of our other funders. As far as HUD, though, I will make sure, Marcus, that I can get you a legit response from HUD. So that way we can look at which route we can go. But I don't know if any other CoC staff have comments on that, but I would certainly be one to entertain the idea.
Karen, I see your hand up.
I just wanted to comment, Marcus, thank you for trying to figure out ways to be flexible to help the folks that are the boots on the ground, trying to get folks connected to resources. I would think if you guys are accepting something verbal that is then being transferred into something in writing where you have documentation, you should have no problem at all with HUD. I know some of the things that we've tried to do in terms of making the process easier to get folks connected to crisis stabilization is we will accept a verification from a faith-based partner, from our police department, from our CityNet partners, from other nonprofit partners. Really, if somebody has the ability to verify, to vouch for somebody that has been homeless so that we can get connected to resources, we really tried to remove those barriers. So I just want to thank you for trying to do that, because it's very much appreciated.
Absolutely, and I agree. whenever I've had conversations with our HUD representatives, it feels very much, at least on the CoC side, that the spirit of all those regulations is trying to carve people into programs as opposed to carve people out, and that they're looking to serve. Already the HUD regulation allows for clients to self-certify if no third-party verification can be obtained. So at the end of the day, to me, this is still a form of verification that HUD would see as third-party. And what I should say is we've made this form fillable. So for your agency staff, if they're at a computer, if they have an iPad, some people are even, pretty good from their smartphone. You could be standing in the field with this client and type on it and type in, I'm Marcus Cannon, I'm an outreach worker, here's the client name, here's the location, here's the date. You can contact me at this number, you can fill it in, you put in the name and the title, as you can see on this PDF, and click send from your mobile device to Home Connect. So that still, I think, would be our preferred method, just so that it saves people having to connect over the telephone. But given that that doesn't happen, a minority of the time, but a notable minority of the time, we wanted to try to raise a verbal process. So Jamie, I'll welcome any kind of official confirmation that you can get from HUD, and then I don't hear any agency, administrators here on the line speaking up saying that this would give them heartburn, us accepting a verbal from their staff. Again, I would say at the end of the day, essentially it's the agency that provides the service to the client that takes on the liability of, is the client eligible? The worker who's making the attestation should be doing so honestly and in good faith, but really at the end of the day, it's that service agency that faces monitoring. So again, feel free to send us feedback offline if you're mulling over this at midnight and something comes to you. But we will, assuming we can get positive feedback from Jamie, we'll send out updates if we're able to start to make this change in process and try to save everybody some time. And then I think this is my last announcement. As most of you know, December 21st is literally the longest night of the year when it gets dark soonest and gets light latest. And so annually since about 1990, communities across the country have recognized this with a Homeless Persons Memorial Day. We've been doing this in Riverside County for a long time. I know many of your own agencies may do your own events, and so we certainly don't want to compete with that in any way. And if you would like Home Connect to advertise any of those events, we're happy to. But we are working together with the HHPWS team. I think officially we're the host, but I think Emma has done more work than anybody else, so we should certainly thank her for that. We'll be releasing a video next week on the 21st at 5:30 p.m. And it will do a couple things. It'll explain what Homeless Persons Memorial Day is. It'll have the list of names of those who have passed away while homeless this year in Riverside County. It will have a couple short interviews from a homeless consumer themselves, from a staff member, things like that to, I think, hopefully to drive home is not the word I want to use, but to share with the community why this event matters and what would we want the community to walk away knowing. What's the call to action? And so certainly our big call to action is going to be twofold. One is get involved with the point in time count. And so we'll use the video to highlight the point in time count. And then we will be listing agencies and ways that people can volunteer and get involved if they want to make a difference in homelessness. So I just wanted to share that. And then lastly, we'll have more details in the days to come, all of the days between now and next Tuesday, about if your agency is willing to reshare or repost this for us. We would love that because we really want to get the message out. And I can only speak for myself, but I think that, in a first world country, when we have so much abundance and so many resources, that it's just heartbreaking that we still have this many people who pass away on the streets. And so we want to make sure that we make that reminder that everybody is somebody, you know, everyone is someone's daughter, everyone is someone's son, and that we need to not let the year pass without remembering that. So we will be working to get this out. And again, we just thank HHPWS and Emma specifically very much for their support. Any questions on that? All right, I put everyone to sleep. Success. That's all I've got for you. Again, my apologies that Morel couldn't be here today to present, and you had to have me as a pinch hitter, but thank you for listening. And again, please send any feedback that you've got to homeconnect@ruhealth.org. Thank you, Mr. Chair.
Great, thank you, Marcus. All right, any further questions? Does it look like it? So we'll move on to housing resource update. I think Karen, you had something.
Yes, and if Susan is still on the line, I wanted to give a shout out to you for your really important feedback on the Good Neighbor Community Policy when we went through that process, because the story that I'm going to give talks about just the process that we went through to get that policy approved in the continuum of care. We had the county's housing department and also Abode Communities approached the city of Corona, indicating that there was a motel that was for sale in the city of Corona, and they wanted to be able to convert that to 58 units of permanent supportive housing. And for those of you that don't know this, the state law does allow and supersede local zoning ordinances. So quite frankly, the developer or the county do not need the city's approval to be able to cite something like that. So there are some mechanisms built in the Project Home Key legislation that allow for that. But the county and following the regional Good Neighbor Community Policy approached the city. And then what we did was we vetted it with all 5 of our council members and our city departments and city manager, and everybody is in full support of it. So we are working collaboratively. Abode will be submitting an application. And I know it's going to be a fierce competition. So we don't know if the project will come to fruition, but I just really wanted to give kudos to Mike Walsh and also Marcus Cannon and Ryan from Behavioral Health, because it's been a team effort. So, you know, fingers crossed, we'll see what happens through the competitive application process.
Great. All right, moving on to item 6. These are just informational items. Once again, amazing staff report staff that's located on the Google Drive and was sent to you as well. On the committee reports, we did have a report from the Youth Advisory Committee and the Youth Action Board. Josh, I think, can we note Susan's comment going forward on the agendas that if there was no meeting, just to put no meeting. Great suggestion, Susan, thank you. So item C, we did not have any requests for letters of support and recommendation. And then the 2 annual reports there are listed as well. Right, and so item number 7 is call for agenda items for next meeting. Of course, as usual, you can submit those to coc@rivco.org, and we'll include those. And then we'll move to item number 8, announcements. David, if you're still on, this will be your time.
All right, can you hear me?
I can.
All right, good evening, or question, good morning, everybody. Sorry about that. Great to be here. I just want to make an announcement that we have apartment availability over here at Camp Anza. We are a long-term housing facility for low-income residents. Veterans have priority, and so we're looking for veteran households of 2 or more to fill our open 2- and 3-bedroom apartments. And so I'm going to go ahead and put my information, contact information in the chat, and that way you can reach out and select somebody or send a client to us, and we can get the process started of trying to get them into this our facility. We've had these things open for quite a bit, and we want to try and get them filled as soon as possible. So thank you very much. God bless, and Merry Christmas and Happy New Year to everyone.
Thank you, David.
Okay.
Other announcements? Danielle.
Hi, good almost afternoon, everybody. I just wanted to encourage our team here that if you have the chance to go ahead and to visit connectie.org. It is a partnership between IEHP and 211, and we have free tools for tracking referrals and other tools. And we also have team members available to assist and train. So please feel free to reach out or visit that website, and really appreciate your partnership. Thank you.
Thanks, Danielle. And it is a great website. Very useful. Jacob.
Hello, everybody. I just wanted to announce that we have the ability, now that we have another supervisor, to bring on some more clinical interns as well as outreach or LCSW interns. So if you know of anyone who is looking to get hours towards their LCSW or MFT licensure, to send them our way. So we offer both the ability to see clients virtually and go out into the field with us to do outreach. We also are one of our outreach workers that's stipend is moving into a different role. So we will have the ability to hire an outreach worker for at least 5 to 6 months if we're looking for if someone's looking for like one of those intermediate, just finished school to getting another job type of situation. So I'm going to put my email in the chat. So if you know of anyone, we also welcome like bachelor students as well who are looking for internship hours or hours towards their degree. So send them my way.
Great. Thank you, Jacob. Any further announcements? All right. If not, I just want to wish everybody happy holidays, whichever holiday you choose to support. And I want to thank everybody. This has been quite an incredible, literally 2 years for me, but definitely a year. And the work that we've done as the Continuum of Care, and especially all the partners that are on this call, and the amazing work by the county staff has really prevented a lot of people, one, from going into homelessness. We saw a report yesterday from the county. We've dispersed over $105 million in rental assistance, leading the state as far as output goes. But just the groundwork and the back of the house work that's been done, the strategic planning, the increase in size of staff, and just the whole department operations has been quite amazing. And then I just continue to be amazed at the incredible work that our partners do. I've been personally engaged in the last couple of weeks in literally taking 2 to 3 people off the street. One that was sick with COVID, so it couldn't do this without you all. So with that being said, again, enjoy the holidays. I look forward to hopefully an easier 2022, and definitely looking forward to the progress I know that we as a Continuum of Care and as partners are going to make.
Yay!
Bless you all. So.
Good job pulling it all together, Josh.
Good job, Josh.
Thank you so much, Karen. Couldn't do it without you.
It's a good team effort, everybody. You guys have a great rest of your day.
Thank
Okay,
you.
Merry
You
Christmas.
too, Karen.
Merry Christmas.
Merry
Merry
Christmas. Happy New Year.
Bye.
Bye.